Did you know a majority of non-traumatic lower limb amputations are related to diabetes?
But as Healthy Living reporter Kate Keller tells us, most of those could be prevented.
That's right, Leslie and Derek. Estimates show that nearly 80% of lower limb amputations in diabetics could be prevented with routine podiatry care. Nearly a quarter of all diabetic patients develop foot problems related to the disease. In fact, the American Diabetes Association says foot problems are the most common diabetic-related complication that results in hospitalizations.
A lot of times they won't realize that something is going on. And so what they need to do is to look at their feet in between the toes, or have a family member do it for them on tops of their feet. Not necessarily would they feel something if something is going on. If there's a redness, area of redness, it might be the onset of an infection, but they may not feel that.
Dr. Robert Debiec says proper foot care is an important part of managing diabetes. He recommends all diabetics, regardless of type and disease stage, check their feet daily and visit a professional podiatrist at least twice a year.
A lot of times the nails will become thickened or ingrown. The patient can't feel them. They're wearing their shoes all day long, which is causing pressure on the nail, pushing it in the skin, developing an infection.
Dr. Debiec says diabetic footwear can cut down on infections by taking preventative measures early. He says patients may be able to avoid serious complications down the road.
Because of the infection, sometimes it will get into bone and then we go into amputation. So we're trying to prevent all those things.
With more local news, I'm Kate Keller.